request everyone to please settle down. Before we proceed with the function, I humbly request all to kindly put your phones on silent mode. On behalf of Dr. BMN College of Home Science, I would like to extend a very warm welcome to all the respected guests. We also extend a warm welcome to the President of the Lions Club of Science, Lion Bhavesh Gala, Secretary, Lion Christine Swaminathan, President of Rotary Club of Queen's Necklace, Mumbai, Rotarian Shilpa Mehta, Secretary, Rotarian Sonal Seth. Special invitees are much respected management members of SMES, members from the Pathak family, principals of various colleges, teaching and non-teaching staff, and our dear students. To begin with the event, may I request Dr. Dilip Trivedi, sir, President of SMES, to give the welcome address. Srimati Dakshaben Pathak Memorial Lecture Series on Women and Health was instituted by Honorary Secretary of SMES, Dr. Bharat Pathak, as a tribute to his late wife, Srimati Dakshaben Pathak. Let us now have a look at the brief presentation on the lecture series over the years in a nutshell. Before we begin with the next segment, I request Principal Professor Mala Pandurang to kindly come and introduce Dr. Vatsala Trivedi.
Very good morning to our respected management members, members of the Lions Club, members of Rotary Club, fellow principals, and dear staff and students. As we know, due to unavoidable circumstances, we all know what the traffic is like, especially when it comes to crossing Siam. And our main speaker for today, Dr. Vrishali, has left very early in the morning, but like most Mumbaikars, she's caught on the Tilak Bridge. And she will be here very shortly. But we have another very eminent person here, Dr. Vatsala Trivedi, who is a member of our managing council. And a big round of applause because Dr. Vatsala has been felicitated by the Zonal Transplant Coordination Organization. Welcome. I think you got a taste of the Mumbai traffic this morning. Yeah. Just before we start with the formal function, Dr. Vatsala Trivedi has been associated with our college for more than 30 years. Dr. Dilip Trivedi is the president of Seva Mandal. And today we're having a talk on by very eminent transplant surgeon, and I think it's only fitting that we have Vatsala by this also. So, ma'am, on behalf of all the students of all the colleges, the staff, and the management, we extend our congratulations to you. And so, with your permission, we will begin with the formal function.
A very warm welcome to our guest speaker for the day, Dr. Vrishali Patil. It is rightly said, when someone you love becomes a memory, the memory becomes a treasure. To honor our memory of Srimati Dakshaben Pathak, I request all the dignitaries to kindly pay a floral tribute. I request all the dignitaries to kindly occupy the seat on the dais. On behalf of Dr. Beeman College of Home Science, I would once again like to extend a very warm welcome to our respected speaker for the day, Dr. Vrishali Patil. Dr. Vrishali Patil is a multi-organ transplant surgeon. Madam is also the program director, head of the Department of Transplant Surgery at Dr. D.Y. Patil Hospital, Pune. To begin with the event, may I request Dr. Dilip Trivedi, sir, President of SMES, to give the welcome address.
Friends, we are here today on a very, what should I say, moment when we are remembering Dakshaben, as we used to call her. And this series has been started by Bharat, who is my colleague and working with us for a period of about 45 years or 50 years. And we have been working together. Now, to give a little background on this, first I would like to say that this is a college which empowers ladies or females. And on this occasion, to have as a speaker Dr. Patil. She is truly empowered woman who has survived in a male-dominated transplant group. Please give a big hand to her. And another thing, that probably she will be one of the few transplant surgeons who are multi-organ transplant doing very good work in the field. So there are hardly few multi-organ transplant surgeons, and that also in that there is a lady multi-organ transplant is something I would say is a rarity. So I would like to welcome her on behalf of SMES and all of us. And without wasting any more time, I will probably hand over the mic to her. Thank you.
Each lecture series has taken us closer to knowing our health better and being enlightened. This year too, we have a renowned organ transplant surgeon, Dr. Vrishali Patil, who will enlighten us more on the topic, life, challenges, and transplant. I now request Dr. Dilip Trivedi, sir, to kindly present the memento to Dr. Vrishali Patil. I also request Dr. Bharat Pathak to present the potted plant to Madam. Thank you, sir. Thank you, ma'am. To familiarize us with the guest speaker for today, may I now request Professor Mala Pandurang, Principal of Dr. Beeman College of Home Science, to kindly do the honors.
Thank you, Ms. Melina. And once again, good morning to everybody. It is my privilege this morning to introduce our eminent speaker for the Srimati Dakshaben Memorial Lecture of 2024. As has been shared with you, Dr. Patil is a program director and head of department, multi-organ transplant and hepatobiliary surgeon at D.Y. Patil Hospital and Research Center at Pune. Dr. Patil's contribution as a doctor is enhanced by a commitment to a cause that we should all actively support, and if I may say so, in life as well as in death, that of organ donation and organ transplant. Dr. Patil performs multi-organ transplants, both adult and pediatric transplants, and of living and deceased donor transplants. This range is, I think, something really to be commended. She has performed liver transplant, intestinal transplant, multi-visceral pancreas transplant, simultaneous pancreas and kidney transplant, isolated pancreas transplant, islet cell transplant, total laparoscopy, nephrectomy, and single port laparoscopic donor nephrectomy. Doctor, I Googled all this yesterday to understand it a little better, as I'm not from the medical side at all. Doctor has studied and received her recognition from reputed medical institutions in India and abroad. These include member of the Royal College of Surgeons, Edinburgh, UK, ASTS certified fellowship from Henry Ford Hospital Transplant Institute, Detroit, again in the USA, a pancreas transplant fellowship at the University of Wisconsin, Transplant Center, which is internationally acclaimed for its work on pancreas and islet transplant. Madam has performed the first pancreas transplant and the first simultaneous pancreas and kidney transplant in Maharashtra state. As a woman achiever, Madam, we salute you for this achievement. Dr. Vrishali is a serving member of important boards for transplant. She is presently Joint Secretary of the Zonal Transplant Tissue Organization, Pune, and specialty expert of the Medical Cell Transplant National Health Authority of Government of India. Dear students, we've had a number of sessions in college advocating the need to be aware of and to promote organ donations. Doctor is a faculty in advocating organ donation and has played an active role in planning programs and teaching hospitals and intensive care units in being organ donor advocates and in formulating organ allocation policy guidelines for the state and Pune zone. Indeed, she leads by example. Dr. Patil, we are confident that your talk will not only be educative from the perspective of medical science, but more so because you will stand before us as a role model for young women, especially, and a source of inspiration for us to strive to excel as professionals, but also to remain as humble and compassionate human beings. I was especially struck by her kindness and her humility every time I made a phone call to her. And I think that this is a lesson that we all have to learn, that despite her remarkable achievements, she remains a very humble and down-to-earth person. Thank you.
Before we begin with the session, I would request all the dignitaries on the stage to kindly occupy the seats in the auditorium. Just an important announcement. The entire session is being live streamed. So we will be sharing the link later on in case you want to share it with your relatives and friends. Thank you. Organ donation is no short of a miracle. It has sprung life from death, sorrow turns to hope, and a terrible loss becomes a gift. To unfold this blessing from the medical world, I now invite our guest speaker for the day, Dr. Vrishali Patil, to kindly address the audience. Over to you, ma'am.
लॉगिन कराओगे ना? Good morning, everyone. First and foremost, it is a great honor, and I'm humbled that Sir Professor Trivedi sir personally came today. I wasn't expecting sir would be there, and I think honorable sir and ma'am to be here for me is like a छोटी मुंह बड़ी बात. जिन्होंने ट्रांसप्लांट शुरू किया, जिनके कारण आज हम लोग ट्रांसप्लांट बिंदास कर सकते हैं, वो आज इधर मेरे सामने है. I think we all are indebted to sir and madam. When I was training as a resident in surgery, actually, I'll tell you, when I was training, we were seeing liver patients, kidney patients. Kidney transplant was something heard of in only bigger centers, and patients were just dying. So I would think कि क्या bilirubin of 20 है, jaundice, severely jaundice patients है, families are just waiting for hope, and we are just going and just treating them with medications, knowing in our heart that there's no hope. It's only when I came to know that sir, about the body of Sir's work in liver surgery, in portal hypertension, in transplantation, Madam's work, and the words which Professor Mala Pandurang told about me, that I've done this representing ZPCC and done first in Maharashtra. Madam has done first transplant in India. So it's a big, I think it's only because of the seeds that they have sowed that we are able to rise up and see the sky and do something. So thank you so much. And first of all, my apologies for the delay. I'm really, really sorry. And I promise that for next occasion or in any event, I would not be late again. My foremost thanks to Professor Principal Mala Pandurang and Assistant Professor Dr. Mr. Srisila, Sharda Srisila, and all honorable dignitaries and professors and faculties, my dear friends, for having me here. I'm honored that you thought of me for this Dakshaben Memorial Lecture Series. I think it is a privilege for me to address a younger audience. I derive my energy from you, and I hope that I'll be able to even give one message today from my talk. I'll be really thankful. So, without further delay, I'll just start. I'm going to talk about transplantation. And oh yes, Zoom. How do we start the Zoom? So login. शायद this अपनी नहीं रहेगा डाउनलोड करना पड़ेगा. While we are waiting for this, and नहीं पता है मला सांगा नाही ओके नाही another 462 612. Okay. Computer. One for me. Yeah. So looks like we are live now. Thank you. Minimize this. Okay. So as I did my transplant training in the US at Wisconsin. So when I went over there, my first day, I had to go and meet the chairman. So outside the chairman's office, while I was waiting, I was browsing bade frames. US, everything is big. So there's this huge big frame with history of transplantation and artist depiction. So there was a lot of drawing about Professor Joseph Murray, who did the first kidney transplant in 1953. Thomas Starzl, who did the first liver transplant in 1963. Richard Lillehei, who did the first pancreas transplant in 1967. Some Chinese scholars' depiction was there in BC when they did some transplants. Then Sushruta was there for skin autologous graft transplant. And then in the middle of that was the photograph of a painting of Ganpati. So I thought must be an Indian painter must have done it. So I said, who gifted you? So they said, oh, it is an American artist, local artist in Madison, who's done this and this has won a lot of prizes also in the medical field. So I said, what do you know about the mythology, Indian mythology and the Ganpati? He said, why you don't know about it? So that concept is an inspiration for transplantation. I was very impressed and humbled. So श्रद्धा स्थान तो है, दुख हरता and सुख करता भी है, but transplant के लिए भी it's a source of inspiration. We still haven't reached head transplant, but who knows when things will be. श्री हरिवंश राय बच्चन ने कहा है कि जीवन है तो संघर्ष है, एंड संघर्ष तो हर एक की जिंदगी में एक पहाड़ की तरह रहता है जिसको हमें पार करना है. औरतों की जिंदगी में तो पहाड़ के बदले एवरेस्ट लिखे हैं किसी न किसी प्रकार के, पर हम भी हम है. बचपन से पैदा ही होते हुए हम लोग एवरेस्ट बेस कैंप ट्रेनिंग लेके आते हैं, तो ये पहाड़ क्या चुनौती है, करेक्ट? सो बिफोर आई गो इनटू द ट्रांसप्लांटेशन, I just share a small video. Maybe you all must have gone through it or seen it on YouTube. But if you can bear with me for a minute. Do you think women can impact our lives, especially in transplant? What do you guys think? Say it loudly a bit. I think the first and foremost person who impacted in transplant as a woman and as a surgeon is Honorable Professor Mrs. Vatsala Trivedi ma'am. Not only the first person to do transplant in India, cadaveric transplant, a lifetime award winner from the Government of India on behalf of Mumbai's ITCC was given to ma'am for her work in organ donation and transplant. If I find it difficult or maybe challenging today, can you imagine the stupendous, the amount of difficulties and hurdles ma'am must have faced in her 1990s and thinking about transplant, performing transplant, getting government policies allocated. At that time, definition of death, definition of transplant, cadaveric transplant करना है तो किसी को मार के transplant करने वाले हो क्या करेंगे? All this plus government policies, people weren't even familiar with the term. Whatever sir and madam have done, I think they are a unique couple. I have yet to see anybody who keeps on like founding fathers and mothers of transplantation in surgery, making way for people like us. But just not the awards and accolades and the body of work. Having the resilience to stand up for herself, to be able to stand up and say what is right and what is wrong, to be at the same time not be perceived arrogant, but be on the righteous path, to be principled. At the same time, have the vulnerability to share, to understand what suffering is about, to love and to teach your junior members. Ma'am and I had not known each other personally. We met for the first time in Chandigarh. I could interact with her. They say that it is true that when we meet people changes or some like when you meet children, we derive energy from them. When I met ma'am for about, I think we spent a few hours together. I think a night talk, we had a heart-to-heart talk, and the next day, the session, I went home back with so much of energy and positivity. So I think you are blessed to have the blessings of both sir and ma'am, and you should continue to seek that out, and don't lose this opportunity. So this is also true in our daily transplant. So I would like you to share with you some of the incidents in multi-organ transplant that I have seen or what I have my experience have been. Let's talk about liver transplant. And sir, pardon me if I say something wrong or if I make any mistake. Sir is, I think, one of the senior person over here. But our liver patients are very sick patients. I'll tell you a story of my patient. One of my patients was 50-year-old and had jaundice. He had become very sick, nutritionally down. He had multiple hospitalizations because he was in coma at one time, had an episode of massive bleeding where he lost a lot of blood, had undergone various procedures to stop that. But once the liver fails, liver is like a powerhouse of our body, right? So once that power की battery खत्म हो जाती है ना, तो it's all temporary mode पे चलता है. So anytime the battery can go down, you can shut down. So this patient had multiple episodes of hospitalization with acute liver failure and was on the transplant wait list. This is the time during August, September, jab Ganpati ke din the, and he was the eldest in the family who would perform this puja. So he thought, this is my last time that I'm going to perform this puja. So the picture is cropped off where his son and family members are holding his hand so that he can perform the puja and hold the kalash in his hand. And this was the way his life was at the time. And because he was on the wait list. So at that time, he received a call for transplant. So whenever there's a call for transplant, a lot of process goes in transplant coordinators, nurses, then associate doctors, junior doctors, intensivists, cardiologists, transplant hepatologists, transplant anesthetists, all come into place not at the transplant center, but the organ donation center also. And at least they all work together to do some special tests pertaining to the organ, pertaining to the patient, insulation is getting transmitted. And once they think that the organs of good quality, the team reaches the donations hospital, the operation is done, then the organ is flown to the transplant program. And this is how the team works together. The bad liver, I'm sorry, pardon me if they are very gory pictures, but
we
actual
need to
transplantation
remove
when
the
it happens,
diseased native liver. To do so,
and this is just
we
an animated
divide the blood
procedure where
supply
the diseased
and
liver
the
looks
bile
nice,
duct.
hard and bulky.
We first
as you saw.
divide the right and left branch of the hepatic artery.
There are a lot of, the liver is connected to our body with very important structures and blood vessels. Along with that, so this is one of the major blood vessels which brings blood into the liver. There's another big major blood vein which drains blood from the liver and takes it to the heart. These all have to be disconnected to remove the old bad liver. See, in kidney transplant, we don't remove the kidneys, but just put a new kidney in. But in the liver transplant, you have to remove the bad diseased liver and then put in a new liver. So you have to disconnect all these major blood vessels, the one which goes to the heart, the one which is coming from the intestine to the liver, the bile ducts which bring bile from the liver to the intestine. So all these major blood vessels or connections have to be disconnected. Then the liver is removed and the new liver is brought in. Before the new liver is brought in, a small operation is done on it. And then once we are sure that it will fit in fine, we bring it and connect it through these blood vessels. The whole operation takes about 6 to 8 hours and sometimes longer if it's more complicated. And once the operation is done, so what we do is you see over here, there's small, maybe I can just fast forward a few things here. So this blood connections are all connected. The bile ducts are connected. And now we have a new liver. And once the clamps are opened, the new blood, the patient's blood goes into the new liver. And this is one of the critical points during the operation, during patient's anesthesia, that the heart and there could be some trouble with the heart or lungs sometimes. But the patients, once they tolerate this, they are brought out and taken care of in the transplant ICU. Nowadays, the patients stay in the hospital for about a week, maximum 10 days, sometimes even 5 to 6 days. With transplant, the blue line shows that if the transplant is done in such patients, they can stay alive for about 10 years in an uncomplicated case. But if not done transplant, people like patients like my patient might succumb within 6 months and may not make it. So this was the patient you saw, and this is him about 2 months after transplant coming with his wife and joking happily. And if you see about most of the, where do women come over here? In transplant and in organ donation, you see 70% of the women, more than men, are likely to donate organs. If you see over here, there are 3 women sitting in front of me. These 3 women donated half of their liver to their either husband or the brother or their sons and daughters. So women come forward for organ donation more. But at the same time, over here, you see this mother donating a liver to her son. There was this little girl, her mother donated half a liver to her, and that is another patient. This was actually a medical legal case almost because at the age of donation is more than 18 years. This 17-year-old donated half of her liver to her father. I think it's still debatable, and I still am not for it so much. But madam and sir might know about this case. So everywhere that you see, and now, so for example, this patient, this is a sister to brother. You see this patient, he's looking tired and he looks like he's been through a lot with this illness. And this is him 6 months after the transplant. So not just that he has dyed his hair and looks younger, but look at that energy in his eyes. So all that is a new life given by one of the women, either a sister, mother. And this still is a concern to us, all of us in transplant field. Definitely everybody should come forward and donate. But we see more and more only women coming. So 70% of the donors are usually women. So I think we don't know when this proposed ratio will become equal. But at the same time, we also know that there have been latest studies that just like we say pediatric is a special specialty, when when your child is unwell, you go to a pediatrician, right? You don't go to an adult doctor. Why? Because children have special different needs. Their health is that they have a different physiology. So they need different kinds of medicine altering that illnesses might have a different spectrum also, a course of outcomes. Similarly, latest studies also show that women are not just men with boobs and tubes. Women they sometimes have a higher rate of disability. They do not withstand organ failure very, very well. Sometimes they succumb to illnesses quicker. So they have though they live longer, they have few healthier years. We don't see women coming forward with illnesses, with organ failure so much for transplant. Definitely the numbers are better than what they were 20 years ago, but the numbers are still less. As a transplant surgeon, the patients who are on the list of transplant, only about 25% are women. And out of this 25%, only about 5 to 10% actually come for transplant surgery because either they become very sick or the family doesn't want to spend so much money on women. I don't know, am I right, ma'am and sir? I mean, there's still a reality, right? That a lot of women are still not coming forward or families are not supporting enough or they feel that, Jane do, I'll bear with it until they are really having complicated illnesses. they won't come for follow up because who look after the family, बच्चे की exam भी है, पैसा भी खर्च होता है. So all these things, I think it's more important to realize. And there have been some studies which show that there's the blood vessel from the heart, which heart and the lungs which are there, they're slightly different orientation for women. I don't know how much in depth about it, but definitely there's a lot of discussion going on that women's health is like more complicated than what we assume it to be. So it's very important that the women's health should be taken seriously, and more women should come forward to take treatment just as men do for their diseases. Let's move on to pancreas transplant. When I came back from my training to India, and there was a doubt raised by a lot of people about what is pancreas transplant. Why is she doing pancreas transplant? And there's no need. In fact, when I joined at some hospital, they were saying, "लिख के दो कि pancreas transplant नहीं करोगे." Yeah. So I said, I have already been trained in that. Why should I write? जैसे कि नहीं फिर हमारे यहाँ नहीं join होना. जैसे कि क्यों पर क्या problem? जैसे कि नहीं बाकी लोगों को अच्छा नहीं लगेगा. ये competitive field है. तो समझ लेना 10-5 साल के बाद देख लेना कि कैसा सिचुएशन है, माहौल देख के सबको पूछ के. जैसे बाकी लोगों ने तो मुझे पूछा नहीं था ऑपरेशन करते हुए. तो why should I ask somebody? If I'm trained and confident to work that do the operation, I should be able to do it. तो ऐसे कर करके फिर I have come to I've joined other hospitals. So that patriarchal attitude or little bit of different politics is still there, and pancreas is still unheard of as a transplant. But what does it do? See, we all know that the diabetic population is very high in our country, right? I mean, until the insulin was discovered in 1922, there were a lot of people just dying because of diabetes and its problems. But now we have lots of advances with insulin pen and different forms of insulin. They've got insulin pumps, which can detect your blood sugar and automatically deliver insulin. And this is all available in the US and UK also, and over here also to some degree. But the problem lies in the finances, the financial burden, and the complication despite the blood sugar control that diabetes does. Diabetes still continues to cause retinopathy, vasculopathy. Patients are the 60% of patients with renal failure are there because of diabetes-induced kidney failure. So all this is because there's some group of cells called islet cells in the pancreas which produce insulin. Either they are defective or they have a defective mechanism for producing insulin, or insulin तैयार हो रहा है पर वहां जाके नहीं हो रहा. जैसे it's like having MSCB में power है पर अपने यहाँ पे plug point नहीं है. या plug point block हो गया है. So there is no insulin is not getting delivered. So either the defective mechanism or source. इसके कारण a lot of diabetes and its complications are there. Now pancreas weighs only 40 to 60 grams. Unlike other organs like kidney and liver, जैसे धुष्ट पुष्ट or solid है, it's a very soft, delicate organ. I think sir has done like I think immense amount of pancreatic surgeries. A lot of surgeons still are scared and don't want to touch the pancreas. So sir knows that. I remember when I came to Bombay Hospital, sir, and I had heard of you doing all HPB and complex surgery. So at one time, I had come to observe your surgery, and there was a lot of students and crowd watching, and I was watching from the top of the stool and looking at your surgery. So kahin se bhi, if I couldn't train under him, I was watching from far to see. So I think taking whatever bit I could learn. So in all, pancreas is a very complex organ, delicate organ, but a very powerful organ. Now, this is another story I would like to share. A young man around 25 years old who had diabetes since the age of 9 to 10. Like this is called as type 1 diabetes, right? So the insulin was defective. He wasn't producing good quality insulin. Now, this was a bright scholar. He was working in a good company and he was planning to appear in competitive exams like UPSC exams and going further ahead. And unfortunately, with his diabetes, he had renal failure. उसके बाद डायलिसिस शुरू हुआ तो जो ऑफिस लोगों ने बोला भाई 3 दिन छुट्टी तो इम्पॉसिबल है, आता है तो भी थक के आता है. तो ultimately gradually was eased off from the job. So he started taking classes at home. Classes with diabetic retinopathy, his vision became a problem. So he could see only from here. So classes भी चले गए because he had to write on board, कैसे सिखाएगा. So ultimately it came to a point when going out of the house, his mother used to accompany him because peripheral neuropathy, so sensations नहीं है पैरों में, दिखने में भी कम है, तो mother was holding his hand to walk outside. At times at night, his mother used to wake him up at 2 o'clock, 1 o'clock. She used to sleep next to him. He 25-year-old की hypoglycemia, मतलब sugars will go down less than 80. There's something called death in bed syndrome, जिसमें क्या hypoglycemic होने के कारण the patients can just collapse into coma and die. So doctors had already told her कि इसके sugars बहुत ऊपर नीचे हो रहे, be careful. Now, this is a patient who attempted suicide twice. The sugars were going up and down. So he came to us. Our team, which is a team of nephrologists, diabetologists, physician, intensivist, everybody worked on him and optimized him. And when there was a pancreas offer, the operation was done. The pancreas was preserved in a very organ preservative solution. And it was, so we implanted the pancreas, or we did the pancreas transplant operation. अभी pancreas operation में पुराना pancreas नहीं निकालते, तो ये नया pancreas कहाँ बिठाते? So under the, just below your umbilicus is a space, या pelvic space. Both in men and women, there's ample space to put organs over there. So if a 2.5 kg baby can stay there, I think any organ can stay there. So this pancreas is put on either on the right side or left side and connected to blood vessels and intestine. I don't, should I show surgical videos? I don't know if the sensitivity, not right, na? So I would move on, I think. I'm so sorry. I don't want to scare all of you, but actually I want to have you interested in this program. So when the you want to see? Okay, but if you have any difficulties, ask me or मैं तो forward कर दूंगी जल्दी.
makroskopisch unauffällig, von weicher Textur
So
und
this is the
unverletzlich.
delicate pancreas. See, देखो
Zeigt
कितना
eine
छोटा है. It's like a
Anatomie,
napkin को अगर fold कर दो, women's napkin को तो हो जाता है वैसे. Now these are the small blood vessels which the pancreas has. When I do the pancreas transplant, I don't touch the pancreas. I put a cold iced sponge around it and hold the sponge, so that even if my touching the pancreas should not get injured. So ये pancreas को थोड़ा clean करते हैं एक बार निकालने के बाद, to make sure that it is in the blood vessels, इसके intestine सब pristine है, all these connections are okay. So this operation, that donor operation with the pancreas दोनों से निकालते हैं, उसको भी 8-10 घंटे लगते हैं, and putting in takes about 5-6 hours. And there's a small operation on the pancreas before we put. I think I should move on. Everybody okay with it? I don't want. I think somebody's closing their eyes. I don't want. I think. I don't want you to close eyes. So, बाद में दिखा देंगे, ma'am. I could see young girls a little bit worried about it. So please don't be. The patient is not in pain when we are doing the operation. He is under anesthesia, very comfortable. And इसकी story बता देती हूँ, so you'll feel little easier. So, ma'am, when we were doing this operation, so I was doing the donor operation next door, and patient has already been in the pre-operative room. So this was the first time. I think I would like to hear your experience. So I came out. कि अभी operation तो हुआ है, so pancreas looks good. I was going to tell the patient कि I think everything looks good. We'll proceed with the operation. So when I went there, they were looking a little. The expression on their face was a little different. They were just serious and looking at me while I was talking, and then there was nothing, no change on their face. So I said, "What happened?" So he said, "Madam, वो क्या है ना, आप जब तक वहाँ कर रहे थे, बहुत लोग आके बोले कि वो पागल है, क्या कोई करता नहीं है ऑपरेशन, पता नहीं कहाँ से सीख के आई, आप मत करो ये." एंड तो ऐसे कि किसने कहा, ऐसे कि नहीं, वो मौसी भी आई, सिस्टर लोग भी बोल रहे थे, कभी देखा नहीं है, कभी किया नहीं है, पता नहीं मैडम भी कितना करते हैं, अभी कभी देखा है किसी को ऐसा करते हुए, हम तो 20 साल से यहाँ पे कभी किया नहीं. And then some doctors also came, and the anesthesiologist also told her, see, I am there for anesthesia, but I have never given anesthesia to this operation. तो जो है ना वो मैडम के ऊपर है. मैं पहले से बोलता हूँ, हाई रिस्क कंसेंट जो है उन्होंने खुद की दे दी कि मैं इस पे जिम्मेदार नहीं हूँ. So they said कि so what do you think, मैडम, हमने क्या करना चाहिए? ऐसे देखो, आप मना करते तो भी कोई प्रॉब्लम नहीं है, आपको आप सोच सकते हो, आप यू कैन विड्रॉ फ्रॉम द वेटिंग लिस्ट, ये किसी और को जाएगा, ऐसे नहीं कि वेस्ट जाएगा. आई जस्ट इन्फॉर्म द authorities and we'll move on to the next patient or next hospital. But I'll tell you what I think, that why I think this is right for you. So I kind of explained to him what his condition is. This is the same patient and what the pancreas looks like. So I said, if given a chance, if there was somebody else, I would still go ahead with this operation. And why I would do it, I would explain to him everything. So he said, give us 2 minutes. तब तक वो पेशेंट बताइए, मेरे को तो करना है, वैसे भी क्या है, 2 बार सुइसाइड किया है, अभी और क्या है. तो he wanted to do it, but his parents were all in tears कि क्या सुन रहे. You know, parents have a different obligation. They want the child to live. कैसा भी है, they want to have the son to live. So I said, it's fine, you can think about it. Then after a few 5-10 minutes, the father came to कि मैंने सब रिश्तेदारों से बात किया. I think चल करते हैं मैम, अभी करते हैं. So in that hospital, the patient, the father and myself were the only ones for transplant. बाकी सब दुनिया अगेंस्ट. So so after we did this operation, his blood sugars, which were going up and down, came back to normal. ये 100 के level पे. There's something called HbA1c which checks your sugars, right? So that was also less than 6, which was 10-13 होता था. So no insulin after the operation. ये भैया अभी तो घूम फिर रहा है. उसने एक कॉम्पिटिटिव एग्जाम देके इंडिया में सेकेंड आया. DRDO में राजस्थान में जॉब किया. While he was doing that job, he somehow gave another Maharashtra state exam. Actually, when you're in a good government position, it seems you cannot apply for some other position. पर इसने कुछ जुगाड़ करके और एक एग्जाम देके अभी पुणे में DRDO में एट अ हायर पोजीशन जॉब किया है. भाग के शादी कर दी और 2 बच्चे का बाप भी है. So these are some of the patients. Now, this is a young girl who is from Mumbai, and she also was type 1 diabetic on kidney failure dialysis. ये तो महान थी. कभी डायलिसिस करती थी, कभी नहीं करती थी, बहुत कंटाल जाती थी. तो फैमिली उसे जाने दो, नहीं चाहती तो छोड़ दो, क्या प्रॉब्लम, जितनी जिएगी उतनी अच्छी है. शी वॉज फाउंड अनकॉन्शियस ऑन द रेलवे प्लेटफॉर्म वंस. फिर एक बार ना भूख लगी कि जाके दे हैड गॉन टू दरगाह फॉर नमाज एंड एवरीथिंग. वाइल एवरीबडी वाज प्रेइंग, बाजू के ठेले पे जाके मिठाई खा के आ गई. तो शुगर एकदम 700 करके सीधा हॉस्पिटल में डायबिटिक कीटोएसिडोसिस कोमा में चली गई. सो ये थोड़ी बदमाश थी. इसका हमने ट्रांसप्लांट किया. इसकी शादी को हम गए एंड नाउ शी इज एक्सपेक्टिंग. सो दीज आर सम थिंग्स व्हिच ड्राइव्स अस टू डू द ऑपरेशन दैट वी डू. Similarly, intestinal transplants is also there. Very few centers are performing it. The challenges are sometimes the days and nights get all confused of we don't know किस दिन पे शुरू किया था, किस दिन पे operation खत्म हुआ. But it's all worth it when we see our patients doing well. When we see that things are going well, people, those who are almost at the verge of dying, are leading new lives. And it's not because of us or because of me. Transplant is a very humbling experience, especially because somebody else's organs जो उसको इसके लिए जिंदगी जान देने के लिए काफी नहीं थे, but he passes away and then his family says yes, they say yes, वो organs किसी और के लिए life saving हो सकते हैं. I work in Pune. So one day I had gone to another hospital for performing the operation of getting the liver, so doing an organ donation operation वहाँ पे. So it was like 11 o'clock at night. I went to the ICU to जैसे we go sir to check the details. Serology सब ठीक है, patient ठीक है, हमने जो बताया information दिया था, everything is fine, everything is all in place. Then this one lady came in and said, madam, ये blood आपको चाहिए था ना? So I saw that she was a relative. So normally in some hospitals still, whenever there's a major operation, the relatives go to get blood from the blood bank. But that's okay, the patients are going to get better. यहाँ पे when this patient was brain dead, so actually dead. So this lady, I saw she was not in the hospital dress. So I said, आप कौन है? तो say मेरे husband है ना मैम. So somebody who's mourning, who was told few hours ago that her husband is dead, whose whose family is gathered, she has so many things to think of कि उसके क्या उसका क्या होगा. उसके बाद पेशेंट की बॉडी को लेना है, उसके जिसको ऑपरेशन करना है उसके ऑपरेशन के लिए शी इज गोइंग टू गेट ब्लड. सो आई सेड आई एम सो सॉरी, आपको पता नहीं गलती से भेजा, क्योंकि नॉर्मली व्हाट वी डू, these families are placed in a special room where somebody is there to talk to them, counsel them, help them while they are waiting for this operation to occur, and then they can take their loved one home for the funeral rites. So I said, I'm so sorry, I think गलती से हुआ रहेगा. आप कहाँ पे, आप मैं आपको छोड़ देती हूँ. I'll ask the hospital department authorities कहाँ पे आप कहीं रूम पे बैठ जाइए. जैसे नहीं नहीं मैडम, मेरा पति रिक्शा वाला था, तो पूरे दिन रात मेहनत करके इस लोगों को सही जगह पहुंचाता था, तो अभी तो किसी और को सही जगह पहुंचाना जरूरी है ना. तो उन्होंने इतना अच्छा काम किया, तो मैं क्यों थोड़ा सा काम ना करूं. मैं देख रही थी सिस्टर ढूंढ रही थी ब्लड लाने के लिए कोई, तो मैंने बोल दिया मैं लेके आती हूँ. तो ये these things make me think what I am doing is just something, the skill that I have learned, and just contributing with that skill. It is this thought because of somebody like her that there's a pancreas and there's a liver and there's a kidney available, and it is because of these families that these are my patients are living their own life and getting up. My own uncle had a kidney transplant, 40 years, still I think scolding strong to all of us. So ये सब है क्योंकि there's an organ donor somewhere, either in the family or somewhere else. Now, I think especially for women, I think it's either you can just accept conditions the way they are. कि बस जिंदगी ऐसी है. It's true in life, true in your illness also, true in your health also. Or if there's some problem, then to make sure that you try to change it to better. And the change does not come because of some time, some mentor, some hospital, yes, some special occasion, yes, special muhurat. We only have to change. Whether it's the circumstances that you read in the newspapers. I mean, we are in 2024, but yet when we say that we are advanced countries, there are so many things as women that we are still looking at as if we are in the primitive era. Whether it's our safety, whether it's our right to health, whether it's a right to share a voice, what we want, our position in the professional careers or in our personal lives, it is important that we think about what we want and then go ahead in that, take the right step, of course, but don't second yourself, don't doubt yourself. The question isn't like, and I took this always with me. This was my motto. I mean, though it's Ayn Rand, I found that I could correlate it so easily. And I think Madam is like that. कि कौन है जो रोकने वाला है? चलो. If you are right, then you can say it. If you are wrong, accept you are wrong and then move on. यार कैसे क्या बोल दिया? Am I right? Should I do it? Should I not do it? If I am ill, how can I do it? So I think we can only move on. And if when you're standing up for yourself, especially for yourself, the whole team will stand up for you. So I've got a huge team which helps me do the transplants that I can do. Now, previously, the operation was a huge, big operation. Lots of blood loss used to occur. And it was a big task because there were no trained assistants. Now I've got surgeons who help me who are trained in transplant. Got robots who, with the help of robots, we are doing this operation now. Now, in this picture, these are two patients. One of them has undergone transplant and one of them has been the donor. Who do you think is the donor and who do you think is the transplant at the transplant? Yeah, operation day is 3. They're all having chai, coffee, biscuit, khare, parle ji ka. Ladies what? That is true actually. Ladies the donor. And the wife is the donor. But I wanted to say that this is day 3 because of advanced technology. The transplant operation has become not only a reality, but a safety that you can think of. It's easily available at least within, I think, your city or your near to your village or place. So I think transplant from what probably was there 25 years ago has dynamically changed. So in our country, things move at a faster rate. I hope for women's health also, for women's rights also, it moves on. But don't wait for somebody to stand up and say, हाँ मैं women's right के लिए करूँगा, तो don't worry, your life will be good. You have to stand up for yourself. We have to stand up for each other. With regards to women's health also. Now, if I think in organ donation, I think it's important that it's because of one person that so many lives are changed. But it's not just this 8 lives or that life of a patient. At the same time, it's the life of the whole family. So at some point, I think one patient saves not only 8 lives, but about 80 families or 80 individuals, considering 10 people in one family. So I don't know, just a message on organ donation. There are no gory pictures here. To clear of any doubt. I feel that tell you that if there's any message that you can go through with my talk today, is that just promise me of 7 days a week, spend at least 4 hours for your fitness, mental fitness and physical fitness. Ensure that you are so fit, both at peace at your mind as well as your body, that you can enjoy the best of your life. Enjoy the happiness, enjoy your career, enjoy your personal life, enjoy the pressure, go travel out, read books, go for movies, but at the same time, when your life in this world is over, when the time comes, because you are fit, because your organs are fit, maybe then they can save more and more lives to somebody else. Okay? So do you guys promise for that? Thank you so much. If you have any questions, let me know.
Thank you, ma'am, for that very elaborate presentation. The forum is now open for queries that our audience can ask.
Okay. Doctor, it's amazing what you present today. Thank you so much. Many times what happens is we may be willing to donate, but ultimately the family is not convinced.
Yes.
So in that case, is there any legal recourse that if I say I want to donate, then
I
does that come in any way?
This is the donation when you are happy for somebody loved one or
Yeah.
after one's death.
After one's death?
I think probably madam is a higher authority to talk on that subject. But right now in India, as of now, the family's consent is more important. But therefore, these talks or therefore the drive that madam is having whenever she goes everywhere, that having this conversation about organ donation से क्या होता है कि your family is already aware कि oh no, she wanted to donate organs. Like I have a friend whose sister was so much enthusiastic about organ donation. She would talk to her family, ना मेरे को I have to do this. I want to donate organs at some point. आप भी करो. So unfortunately, when her sister had an accident, that time the family said, नहीं उसकी इच्छा ही थी ना करने की तो कर देते. When you haven't spoken it out and you really wanted to, but then if it comes to a point, at that point, family said, ये बाद में ना ये operation, they want to just make sure that everything is okay and take the loved one home. So not that they are against organ donation, but misconceptions and misunderstandings के कारण people say no. और family says yes and then कहीं दूर का चाचा बोलता है नहीं यार बस करो 10 बजे का मुहूर्त वहां जाना है वहां करना है तो ऐसा भी होता है. So there are many things. Yes.
Dr. Patil, a word about uterine transplant.
Uterine transplant, sir. Uterine transplant is usually a living donor transplant, which is done. Very few people do it. It's usually women who have a difficulty in conceiving or have their uterus removed, but they're in the reproductive age period, or they would like to have children. Then their mothers usually have what you call this. They can donate the uterus. This is then implanted into the lady, and then the uterus had there have been operations which have been successful. The ladies have conceived children, and once the baby is born, the uterus is removed. So post-transplant, the patients don't require as much medications as other organs transplants require. It is still a very few centers do it, no, sir? And legal, I mean, there's a lot of discussion yet as to the right, because adoption is there, a lot of things are there. So, I mean, personally, I have a little bit of reservation, but that is my personal thing. And is it a science? Are there have been centers doing uterine transplant? Yes. Is there an operation about uterine transplant? Yes. And some babies have been successfully born through it. But as the transplant scenario is evolving in our country and abroad, I think so, as more policies come into place, we'll come to know really the outcome and is it really worthwhile, right, sir? I think that is what it should be. Thank you.
Any more questions that anyone would like to ask?
Yeah, I would like to. Thank you so much for this really required session.
Thank you, ma'am.
I just want to ask you a very general question. Say a person is no longer there, has expired. So how many hours, have to be, or how soon has the hospital to be informed that, so that the organs can be harvested?
Ma'am, if the person is already passed away, and if the person is, when he's passed away at home, for example, or passed away in a hospital, but is not connected to any supports, then at that time only the cornea, there is eye donation and skin can be taken. For organs to be transplanted, the person has to either be brain dead or there's something called as circulatory death. So at that time, the patient has to be on life supporting machines. Now, why? Because once a person dies, automatically the other organs will also go into death. Therefore, these organs, while they are on supports, the lungs on ventilators, so oxygen delivery is going on. The blood pressure is well maintained, therefore the cardiac rhythm is going on. So after the person is brain dead, then at least there's some few hours there where the organs will have some good vitality and quality for organ transplantation. So therefore the reason for this drive, see, so log agar sign up karte organ donation, out of which only say 10 people will be in the hospital at the time of the death, out of which one person might be on the ventilator and eligible for that. So sign करेंगे तो एक कहाँ donation हो सकता है, उसमें अगर फैमिली ने मना कर दिया तो 0 भी हो देगा. So we want 100 करेंगे तो 100 ने donation के लिए if the time comes. तो but I think that is the reality. So if the patient is on a ventilator support and medicine and the medication supports in the hospital, then organs can be transplanted. At home, that's eye donation and skin donation. A lot of, our country is evolving in terms of organ donation, and I think I'm more in the transplantation, and I think Madam is an authority on formulating policies and guidelines for all hospitals in our country, and especially in our state and city, to how, and she's actually a vigilante who looks or ensures that no wrongdoings occur. That the right, if the person has the organ donation has occurred, it goes to the person who deserves it, not somebody trying to bypass. So that is very, very necessary, and that occurs, I mean, in our country, especially as we are evolving, since all policies and guidelines are not in place, we are changing things. Madam has already gone to Rajya Sabha once, and even now, Madam has been invited to formulate guidelines and reforms for our Organ Donation Act and transplantation policies. Example, I'll tell you, for example, in Pune, we had this incident, sir, Madam already must be knowing, where one of a very good corporate and a good prestigious hospital, there was a child who was brain dead. The mother said that, yes, I would like to donate my child's organs. Now, she was a professional sex worker, but she was the mother. There was a birth certificate and everything. So the child was her son. But the thing now, the person at the other end, whether it's a coordinator or the managing person or who are the authorities over there, they said, okay, where is the child's father? Because it is child, I want the father. So father chahiye. So she said, ki sir, father nahi aa sakte, dekhiye kuch ho sakta hai. So they said, ki no, father is required. So birth certificate पे जिसका father का नाम था वो बंदा तो उसके contact में ही नहीं था. So she then tried to contact the person. So another 6 to 8 hours went. She contacted that person. That person was somebody who was very kind enough to said कि नहीं कोई बात नहीं. When she was pregnant a few years, so the child was 12 years old. So 12 years ago, where she was in another place, at that time in a rural town or whatever, that man had given his name for thing. So he really was not the child's biological father, but he had said yes. So then he tried to contact him. He said, मैं तो अभी इतने कोस दूर हूँ. If you want, I will come, but I cannot come right away. That would mean at least another 24 hours. So then she said, तब तक there's another person who at her place who said, but I am there with her. So I will vouch, I will write कि I will take care. So I'll take responsibility. ऐसे में से 2 people came forward. The hospital authority still said कि नहीं, father, biological father ही चाहिए, नहीं तो donation नहीं हो सकता. Actually, by guidelines, actually, madam knows that the mother says yes, and if they could have still gone for donation. So we, as in the transplant field, in organ donation field, we see a lot of hurdles, and therefore there are a lot of reforms to take place. And madam and people like I think madam seniority, everybody, they are trying to help place these reforms. But therefore, transplanting, as you saw, it does help people, but we are still saving few people. And there is a huge need for organ donation and huge need for reforms in these policies.
Thank you, ma'am, for patiently answering all the queries. May I now request Dr. Shilpa Charankar, Executive Secretary of SMES, to kindly convey the response on behalf of the Pathak family.
Namaskar. Today's very eminent speaker, Dr. Vrishali Patil, Dr. Dilip Bhai Trivedi, President, Seva Mandal Society, all the office bearers of Seva Mandal Society, members of the Lions Club of Science, members of Rotary Club of Queen's Necklace, Pathak Parivar, principals of SMEs conducted colleges, invited guests, teaching and non-teaching staff, and dear students. Srimati Daksha Bhabi, my Bhabi, a very long association with Bharat Pathak family for last 40 years. Daksha Bhabi, very loving, caring, soft-spoken, very calm and quiet, and great human being. We lost our dearest Daksha Bhabi on 3rd September 2007 due to cancer. Dr. Bharat Pathak, Honorary Secretary of Seva Mandal Society, in fond memory of Daksha Bhabi, initiated a lecture series on women and health for last 17 years. His motto is Sarve Sukhina Santu, Sarve Santu Niramaya. He has a great concern of well-being of all, especially women. I just need to share from Times of India, the paper, March 29, 2023, quote unquote, even after 76 years of independence and efforts from central and state government, yet 20% of women of reproductive age are undernourished. Anemia, another significant health issue, with nearly 60% of women aged 15 to 49 are anemic. India has a maternal mortality rate of 174 deaths per 1 lakh live births, which is significantly higher than many other countries in the region. Around 50 million women in India suffer from reproductive health problems. Also, the breast cancer and cervical cancer remain the most common cancer among women in India. According to National Health Profile 2019, there were approximately 96,922 deaths due to cervical cancer in India. Additionally, according to the Indian Council of Medical Research, an estimated 87,000 women died from breast cancer in India in 2020. This highlights the urgent need to improve access to quality healthcare services for women in the country. We always observe that women take care of their family members, but they neglect their own health. I remember a president always says, very clearly, if a lady of a house collapses, everything collapses. As women, we should remember health is an investment and not the expenses. From the presentation on women and health, we see that variety of sessions like diabetes, osteoporosis, stem cell, cardiac problems, breast cancer, TB, blood pressure, such important related issues for women health have been dealt with. It is not just a lecture series, but Bharat Bhai has organized and sponsored so many health camps, mammography tests, general health checkup camps, and exhibition for the benefit of women. As you know, today also the camp has been organized and is going on. Bharat Bhai's total focus is on creating awareness related to various health issues and to get 100% best health to each member of SME's family. He strongly believes in prevention is better than cure. It will be a great tribute to Dakshaben if all of us take care of our health and keep ourselves fit. It is rightly said that health is wealth. Bharat Bhai has fully dedicated his efforts for the well-being and the betterment of society, especially in health sector with his selfless services. Dr. Vrishali Patil, Madam, hats off to you. The way you made the topic, because liver transplant and all the transplant, organ donation is such a complicated issue for us, but you made it so simplified. And with the case studies, it was wonderfully explained. Madam, really, thank you so much. And you rightly said the message what you pass on. I think we should assure her that is we will take care of your mental and physical health. I am greatly honored by Bharat Bhai by getting the opportunity to give responses on behalf of Pathak family. Thank you, Bharat Bhai. Special thanks to Dr. Vatsalaben Trivedi, Dr. Dilip Bhai Trivedi, Dr. Mayuri Trivedi for their constant support on getting the excellent speakers for women and health. Madam has simplified the topic, even various issues which you are not aware of. It is really simplified with the case studies, and the presentation was very clear. And I'm sure we will surely take care of ourselves and we will concentrate on the fitness. Once again, thank you so much. Thank you all.
Gratitude helps you see what's there instead of what isn't. We have come to the conclusion of yet another very enriching session under the Srimati Dakshaben Pathak Memorial Lecture Series. To express this gratitude, may I now request Mrs. Shilpa Shettigar, Principal of Srimati Sunanda Praveen Gambichan Institute of Nursing and Paramedical Science, to propose the vote of thanks. Over to you, ma'am.
Good afternoon, everyone. Before my vote of thanks draft, I would like to inform you, madam, here that madam is not only she has drafted many this clause related to organ donation. She has identified even there is a awareness in the community for organ donation. Like everybody is asking you so many queries here, but there is no such qualified manpower who will remove or retrieve that organ and can be placed to the right person and it can reach. And for that, she has started working, we are lucky here for nursing college. She is our pioneer. We are a pioneer in drafting a course of transplant coordinator. And we have conducted with Maharashtra University of Health Sciences 4 batches of transplant coordinator, as well as this course is affiliated to Maharashtra University of Health Sciences, DMER, and NDTN, and Nursing College, our trust. With this, that course, not only we have completed the batches, the whole around 33 lectures of various eminent speakers, surgeons, all over like from India, from Mumbai, well-known surgeons. They have drafted lectures with surgery videos, counseling sessions, and this course is conducted through the online port of Nursing College, and which is available for many colleges. And we do this for nurses, social workers, homeopathic doctor, Ayurvedic doctors, and the men. Every year we have 300 to 400 candidates under that section, sir. Thank you, ma'am, for this. I, Mrs. Shilpa Shettigar, Principal, Srimati Sunanda Praveen Gambichan, Institute of Nursing and Paramedical Sciences, on behalf of Seva Mandal Education Society and Lions Club of Science, I extend our heartfelt thanks to Dr. Vrishali Patil for her enlightening lecture on life challenges and transplant. Her insight as a multi-organ transplant surgeon and director of transplant surgery at Dr. D.Y. Patil Hospital, Pune, have been truly inspiring for us. We express our sincere gratitude to Dr. Vasila Trivedi Madam for her vision towards empowerment and for this institutional goals. I extend my heartful thanks to Dr. Bharatbhai Pathak and family for their support in honoring the memory of Srimati Dakshaben Pathak and further our shared commitment to the women's health. I thank to all management members for their constant encouragement, interest, and continued support in all the activities. Also extend our thanks to beloved Dr. Shilpa Charankar Madam for her constant support and minute-to-minute monitoring of this event. Thanks to all the principal, staff, students for their participation in this event. I would like to thank our organizers, especially Dr. BMN College of Home Science, NSS unit and Women's Cell, who have given their valuable contribution to all the attendees for making this event successful. A special thank to all technical team. And I cannot thank everyone enough for the involvement they have shown and willingness they have expressed to take on the completion of this task beyond the comfort zone. Thank you all and have a great day ahead. Thank you.
Thank you, ma'am. We have come to the formal conclusion of today's session. I request the audience to kindly be seated while the dignitaries exit the auditorium.